My name is Dr. Stephen Ye, and I grew up in Houston, Texas. I did my medical training at the Baylor College of Medicine in Houston, subsequently did a fellowship in uveitis, which is related to ocular inflammation, inflammatory diseases of the eye at the National Eye Institute, National Institutes of Health, and subsequent to that did a fellowship in retinal disease and surgery at the Oregon Health and Sciences University, and was at Emory for about 10 years practicing uveitis and retinal disease and surgery, and had the privilege of coming here to start on as faculty and professor of ophthalmology for both uveitis and retinal disease and surgery. So I'm dually trained in both uveitis and ocular inflammation, and also retinal surgery and retinal disease. And so I did training at the National Eye Institute, National Institutes of Health, performing some research on the bench in the laboratory, but also taking care of patients in the clinic as well, related to inflammatory disease of the eye. So within the spectrum of ocular inflammation and uveitis, I would split this up into infectious disease and non-infectious or autoimmune disease conditions. So within the realm of infectious disease, these are conditions such as tuberculosis, which is a public health problem, and worldwide it's a public health problem, but also other more common conditions such as herpes simplex, varicella zoster virus, which causes chickenpox, can lead to inflammation of the eye. And besides these infectious conditions, we also treat non-infectious or autoimmune conditions. So there's some conditions such as rheumatoid arthritis, systemic lupus, sarcoidosis, that can also lead to eye inflammation. So really managing these types of conditions with subspecialty partners such as rheumatologists, both adult and pediatric specialists, really is helpful for patients with these complex medical conditions. Besides uveitis, I also take care of, again, patients with retinal disease such as macular degeneration and retinal detachment, which are more common, but also can be severely vision limiting and vision compromising and need to be addressed with medications and sometimes with surgery. So our group does a good amount of work in global health related to infectious diseases that affect the eye. Our group specifically works on Ebola and how it can impact patients after they've survived Ebola. And this is linked into our work both in the United States, healthcare workers, as well as patients that we take care of in West Africa, in Sierra Leone, Liberia, the Democratic Republic of Congo. But what we found is that part of the problem is an infectious disease problem. Part of it actually has to do with a resource limitation and a systems-based problem, that there's health systems that need to be strengthened in partnership with ophthalmologists that are working in these countries in sub-Saharan Africa and around the world. At Nebraska Medicine, and University of Nebraska Medical Center, we see quite a few patients who have seen other physicians previously, and so there can be a lot of uncertainty with regards to their disease condition, both related to complexity and also sometimes the severity or the advanced nature of the disease condition. So I really like to listen to the patient to find out what their experience has been, what treatments have worked, what treatments haven't worked, and what are their key questions that they would like to have answered. Oftentimes, the first question is, what do I have? What's the disease that's compromising my vision? And that requires a diagnostic workup with both laboratory and sometimes different radiologic testing. And the second question is related to treatment. What is the best way to take on this complex disease condition? I find that there's an array of medical therapies that we think about, both from medications, ranging from medications to surgery, to other interventions that are at the cutting edge. And so I really like to have a complete dialogue with the patient to try to answer all of their questions that they may be thinking about or their families may be thinking about, to really fully have them have a comprehensive understanding of their disease condition. I think that really it's by knowledge of their disease condition and the different options that are available. Having this conversation, I think, helps to put patients at ease and really help to drive the patient care using a team-based approach.